When it comes to healthcare in the United States, understanding programs like Medicare, Medicaid, and the Affordable Care Act is only half the story. Knowing how to actually enroll in these programs, when you're allowed to do it, and what happens if you miss the deadlines is just as important. In fact, thousands of people every year end up paying penalties or losing coverage simply because they didn't understand the enrollment rules. So in this video, we're going to break it all down: how to sign up, who qualifies, when you can apply, and how to avoid costly mistakes. Let's start with Medicare. For most people, the first chance to sign up for Medicare is when they turn 65. This is called the initial enrollment period, and it lasts for 7 months. It begins 3 months before your 65th birthday, includes the month of your birthday, and continues for 3 months after. During this time, you can enroll in Medicare Part A and Part B. For example, if your birthday is in June, your initial enrollment period runs from March through September. Missing this window can lead to penalties, especially for Part B and Part D. Part A is usually premium-free, so most people sign up right away, but Part B requires a monthly premium, and delaying enrollment can mean a lifelong late penalty added to your premium. Now, what if you're still working at 65 and have health insurance through your employer? In that case, you may qualify for a special enrollment period. This allows you to delay Medicare enrollment until your job coverage ends, without facing penalties. The key is to sign up within 8 months of losing your employer coverage. For example, if John works until age 68 and then retires, he has an 8-month window to sign up for Medicare Part B without penalty. If he misses it, his premium could go up by 10% for every 12 months he delayed. That's a huge cost over time, which is why paying attention to deadlines is critical. There's also something called the General Enrollment Period, which runs from January 1st to March 31st every year. This is a fallback option for people who missed their initial window. But there's a catch: coverage doesn't start until July, and you'll likely face late penalties. That's why it's much better to enroll on time during your initial enrollment period. And for those already on Medicare, there's an open enrollment period each year from October 15th to December 7th. During this time, you can switch between original Medicare and Medicare Advantage, or change your Part D prescription drug plan. Now let's talk about Medicaid. Enrollment for Medicaid works a little differently. Since Medicaid is a joint federal and state program, the process depends on the state you live in. The good news is that you can apply for Medicaid any time of year. There is no limited enrollment window like Medicare or ACA. You can apply through your state's Medicaid office, online portals, or even at local social services offices. Eligibility is based on income, family size, disability status, and sometimes other factors. For example, a single mother with 2 children and very low income can apply for Medicaid at any time during the year, and once approved, the coverage usually starts immediately. That flexibility makes Medicaid a crucial safety net for families living paycheck to paycheck. However, Medicaid applications do require documentation. You'll need proof of income, proof of residency, and sometimes information about your assets. For example, an elderly man applying for Medicaid long-term care might need to show bank statements and details about his savings. States use this information to determine if you qualify. And while Medicaid enrollment doesn't have late penalties the way Medicare does, delays in applying can still leave you uncovered when you need care. So it's best to apply as soon as you think you qualify. The Affordable Care Act, or ACA, has its own set of rules. ACA coverage is available through the health insurance marketplace, and here the timing really matters. The annual open enrollment period for ACA plans typically runs from November 1st to January 15th, though dates can vary slightly by state. This is the time when anyone can shop for plans, compare premiums, and apply for subsidies. If you miss this window, you may not be able to get coverage until the next year, unless you qualify for a special enrollment period. Special enrollment periods under the ACA are triggered by life events. These include losing your job-based insurance, moving to a new state, getting married, having a baby, or losing other health coverage. For example, let's say Sarah loses her employer coverage in April. She doesn't have to wait until November. She qualifies for a special enrollment period and has 60 days to sign up for a marketplace plan. But if she simply forgets and misses the 60-day window, she'll be uninsured until the next open enrollment. So what happens if you miss deadlines? With Medicare, the most common problem is the Part B and Part D late enrollment penalties. These penalties are permanent, they don't go away. That means you'll pay higher premiums every single month for as long as you have Medicare. For ACA, missing deadlines usually means waiting months without coverage, unless you have a qualifying life event. And with Medicaid, while there aren't financial penalties, waiting to apply could leave you uncovered during a health crisis. In every case, missing deadlines means unnecessary risk. It's important to remember that enrolling is not just about signing up, it's also about reviewing your coverage every year. Medicare beneficiaries need to check if their Part D drug plan still covers their medications. ACA users need to see if they still qualify for subsidies, because income changes can affect the amount of financial help they get. And Medicaid users may have to recertify their eligibility annually, especially if their income has changed. The process may sound complicated, but the good news is that help is available. Medicare has a toll-free helpline and local counselors who guide seniors through enrollment. Medicaid applications can be supported by local social service agencies. And the ACA marketplace has navigators who help people compare plans for free. The key is not to wait until the last minute. Start early, gather your documents, and understand your deadlines. In the end, healthcare enrollment is all about timing and awareness. Medicare requires you to pay attention to birthdays and retirement dates, Medicaid depends on income and state rules, and ACA revolves around the annual open enrollment and special circumstances. Knowing these rules is the difference between smooth coverage and unexpected penalties or gaps. So if you or your loved ones are approaching 65, struggling with low income, or need coverage outside of job-based insurance, remember this: enrolling on time is just as important as the coverage itself. Don't let confusion or procrastination cost you your health or your money. Plan ahead, know your options, and take action. Because in healthcare, the deadline you miss today could become the bill you regret tomorrow.